As doctors, we often encounter patients telling that my child has tonsils, and parents often have the doubt whether surgery needs to be done or not. What really is the scientific explanation behind this? Let us see in today's video. Hi friends, I am Dr. Karamat and this is Scientific Doctor channel. In this channel, every Wednesday you will see videos on medical science related topics. If you want to see such videos, kindly subscribe to this channel. Also press the bell icon to get notifications on new content. Today's topic is tonsils or tonsillitis. In this context, we have to be clear about certain terms. What are tonsils? Tonsils are normal parts of the body. They are internal organs situated in the throat on both sides, fleshy pink masses. Are they normal? They are absolutely normal organs, just like your nose, hands or ears. Tonsils are normal organs which are present in every individual. What are the functions of tonsils? Tonsils, in addition to adenoids and another organs called lingual tonsil, form a ring-like structure which are part of the immune system which encounter organisms or infections entering through oral cavity and through the respiratory tract, and they form the first line of defense. So these are essentially normal parts of our immune system, very helpful in immune function and even more helpful in immune memory. So where is the commotion of tonsils being present and being it abnormal? So whenever doctors say about tonsillitis or infection of the tonsil, that's what many common people think or mistake it to be. Mere presence of tonsil itself is abnormal. So presence of tonsils is not abnormal. Tonsillitis or infection of tonsil is abnormal. Okay, why do infections of tonsils occur? Tonsils are present in the throat. So as part of a respiratory tract infection or a throat infection, your tonsils may also get infected by viruses as well as bacteria. As in the majority of other areas, viruses predominate in infections of tonsils also, but bacteria are almost 1/3 of it, and an important bacteria called group A streptococcus can infect tonsils. Why is it important? This bacteria can give rise to complications like rheumatic fever, which can involve the heart, and glomerulonephritis, which can involve the kidney. That's why whenever there is a throat infection or a tonsillar infection, your doctor is concerned whether it is bacterial or viral. This tonsillitis or infections of the tonsil are more common in children like any other respiratory tract infection. What are the symptoms of tonsillitis or infection of the tonsil? Like many of us know, there will be pain in the throat, especially while swallowing or speaking. There can be change in voice or hoarseness of voice, fever, pain which can be sometimes referred to the ear, headache, sometimes bad breath can be there. These are the symptoms of tonsil infection. On examination, that is the signs which the doctor may identify are the tonsil may become enlarged, it may become red, and there can be enlargement of the lymph nodes in the neck and also pain and tenderness in these lymph nodes. Sometimes a whitish patch can be seen over the tonsils. How do doctors diagnose infections of the tonsil? Usually by clinical examination. Most of the times your doctor might be able to diagnose tonsillitis. Sometimes a throat swab, where a swab is inserted and the secretions over the tonsil are taken to identify the organism infecting the tonsil. How do you treat tonsil infection? If it is a viral infection, some painkillers or analgesics may be given and your antipyretics or fever treatment medications will be given. If it is due to bacterial, antibiotics will also be given. Their course has to be properly completed. Then what is the worry regarding tonsil? People often get worried because the tonsils are big in children. We have to understand tonsil, unlike many other organs, has a different growth pattern. That is, tonsils and adenoids grow in children and then they atrophy or they shrink. so they may not be visible in adult life. Adenoids grow around 3 years of age and they shrink after 7 years of age. Tonsils roughly around 3 to 4 years of age they start to grow and they start to shrink after puberty, roughly around 12 to 13 years of age. So during childhood tonsils are growing, so they may be large, so they may be easily visible. That's what makes the parents worried about presence of tonsils itself. So this should make it clear that visible tonsils are not a problem, but infection of the tonsil is. So now we know tonsil is a normal organ and enlargement of tonsil alone is not a problem. So when do we go for removal of tonsil or tonsillectomy? As we know, anything good can also be bad if it is in excess. So even though tonsil is part of the immune system, it is there to fight off infections. If the number of infections is high, that is more than 7 infections in one single year, or more than 5 infections in each of 2 consecutive years, or more than 3 infections in consecutive 3 years, that makes an indication for removal of tonsil. Also, if the tonsil infection becomes worse and if there is pus, which is sometimes called as quinsy or peritonsillar abscess, then it may be an indication to remove tonsil. But in modern times, the most common indication for removal of tonsil is obstructive sleep apnea syndrome or OSAS. What is this? This is a scourge of the modern society, associated often with obesity, where if the tonsils are also enlarged, they obstruct the air passage during sleep especially. So what happens is, because of obstruction of air passages, you stop breathing for few seconds. Because of this stoppage of breathing, your sleep gets disturbed. Even if you don't know, because of the disturbed sleep, you might not function properly the next day. There might be snoring and other symptoms. If these symptoms are there, your tonsil might have to be removed. This is the most common indication for removal of tonsils nowadays. Even after tonsillectomy, you are still liable to get throat infections. So removal of tonsils alone will not stop the throat infections. It is only if the tonsil infections are more, or if there is obstructive sleep apnea, or if there is a pus collection, your doctor might advise you to remove the tonsil, but that will not alleviate all throat infections in your child. Friends, today we have seen in this video little about tonsils and tonsillitis and when the tonsils should be removed. If you like this video, kindly share it among your friends and relatives. If you have any doubts, kindly put it in the comment section. I will try to answer all your doubts. If you like to see such videos, subscribe to this channel. Till the next video, bye.